So this is part 13 in our wild harvest edibles, and it's always just neat to discover the things as we're going along, the things that we see around us on a daily basis sometimes that are just sometimes common weeds that actually have significant benefits. And just a reminder that many times those things that are edible are considered therapeutic in senses or ways that they're applied or utilized in addition to their food activity. And just a reminder that if you implement any of these things in your health toolbox, that you check it out and use it appropriately. And if you have a health challenge of any kind, that you enlist a medical practitioner that has the same philosophy of care that you do, just so that you have congruency in your health plan. And a reminder that Thomas Edison said that the doctor of the future will give no medicine, but will instruct his patient in the care of the human frame, in diet, and the cause and prevention of disease. So our topic is a plant called the teasel, wild teasel. This plant was always pointed out to me as a youngster because my mother particularly appreciated the dried variety there on the right. And the birds appreciate it too. She thought it was just a neat thistle. It's a type of a thistle, and it's called Dipascus silvestris or Pholonoum, depending on which species you're looking at. They both have similar properties. Its edibility is somewhat narrow in scope, in that basically the young leaves are the edible portion. The short hairs on those tend to deter their edibility, although they can be eaten cooked or raw or added to a smoothie. So down here in the lower right, you can see a picture of the early teasel coming up. This would be the edible stage before it ever gets to the flowering stage. They can be purple or they can be white. They have different color flowers in that teasel top. And then come fall, they'll dry up, and it'll give you a good idea of where a patch of those would grow up the next year. So you can use that as a kind of a radar for where they would be in a subsequent season. The root is not used from an edibility standpoint. It's used as a medicinal herb. So the leaves, the young leaves, are a pot herb, you would say. You would put them in your pot and eat them. A smoothie would definitely take away the detrimental aspects of the hairs on the leaves, and cooking would probably soften them up significantly too. So that's something that you find in clumps usually in various places across the United States. So by far, this one happens to have a significantly larger portion of it that has a medicinal aspect to it, has very powerful medicinal qualities associated with it. And you want to use the tincture cautiously and carefully because there can be some significant manifestations if it's used too rapidly. So I'll describe that here. So you can use it internally and externally. The internal use, particularly if you have Lyme disease or suspect that you may have Lyme disease, it's very important to go slow with the tincture of teasel. The maximum intake for a tincture of teasel with Lyme disease would be 9 drops, split into 3 different times over the course of a day. And so there'll be 3 drops morning, afternoon, and evening. But you want to begin with just 1 drop. 1 drop in the morning and 1 drop in the evening. And at day 3, you can add another drop. So you're doing it morning, afternoon, and evening. Day 4, and each successive day, continue to add a drop. So you're equalizing out to 3 drops in the morning, 3 drops in the afternoon, 3 drops in the evening, with a maximum of 9 drops of the tincture. So the reason for this is that there's something that can happen if you happen to have Lyme disease, or if you have Lyme disease and you're wanting to rid yourself of Lyme disease. There's something called the Jarisch-Herxheimer or Herx reaction. And this indicates the presence of Lyme disease. So if you're taking a drop at a time and you don't experience any kind of a reaction, then that's a good thing. You can increase without having to worry about it. But the Jarisch-Herxheimer reaction, JHR, it's a clinical phenomena that comes and goes, or comes upon the release of the toxins, essentially. It's basically seen in patients that have spirochetes that are undergoing antibiotic treatment. And the spirochete is what Lyme disease, it's a tick-borne disease, and the Lyme spirochete is a type of bacteria that is inside of that tick that when it's treated, if it's treated early on, it can be successfully treated with antibiotics because it hasn't set up camp yet, so to speak. But as the infection would wear on, it becomes harder and harder to treat. But this tincture of Teasel can be helpful in being able to do that. So the reaction occurs within 24 hours of antibiotic treatment of spirochete infections. So as they start to die. So including syphilis, leptospirosis, Lyme disease, and relapsing fever. So these are different types. Also can be seen in other types of yeast kind of challenges. So it typically is like fevers, chills, rigors, that's a stiffening of muscle, nausea and vomiting, headaches, racing heart, that is tachycardia, hypotension, which is suppressed or lowered blood pressure, hyperventilation, flushing, myalgia. So myalgia is muscle group pain. So fibromyalgia is just a kind of a collective term for sore muscle groups, and skin lesions that may become worse. So this is a definition from the National Library of Medicine. So for the Jarisch-Herxheimer reaction. So it sounds like a pretty significant transient. That means it comes and goes, or it will go away. It's not a permanent thing. So if you happen to have Lyme disease and you start to take the tincture, you could undergo some of these symptoms for a period of time, but they would go away as that infection is then combated. And this allows that infection to be combated, the use of the Teasel tincture. So the Herx reaction, it's an adverse reaction to the cytokines, which are basically cellular produced proteins that move as the Lyme spirochete is killed. So there's two types of cytokines. They're inflammatory cytokines and anti-inflammatory cytokines. So basically, cytokine is basically just a cellular secretion that essentially communicates between cells. So we know that on the surface of the cells, it's fuzzy, as you can see in this picture here, and those are cellular antennae that allow intercellular communication. But between cells, they can send chemical messengers between them as well, and that's what the cytokines do. So we have heard recently in the last year of something that maybe you hadn't heard of before called the cytokine storm. It's basically a huge release of different inflammatory cytokines in an attempt of the body to rid itself of an infection. And that can be very disastrous if not checked appropriately. But it has a very positive role too. So glycoproteins are cytokines. And some of them have positive roles and some of them have overactive or negative roles associated with them. So basically, it's an inflammatory response that aggressive inflammatory cytokine release can create if there is some kind of an infection. And that's what begins to happen during the Herx reaction. Essentially, once the bacteria are dead and their toxins and byproducts are eliminated from the body, that's why we call it a transient reaction. So fever, chills, all those kind of things, those will go away. The Herx reaction will go away once those dead bacteria are released from the body, cleared from the body, and their byproducts, or toxic byproducts, are released from the body. Once you're rid of the Lyme disease and its disease-causing component. So it's a very powerful but positive result. So it means that the Lyme spirochete is dying. And although a person may feel terrible during that period of time, they expel the spirochete as well as the toxins and rid them from the body. So it can actually be used as a preventative for Lyme disease. So if you're in an area with Lyme disease being a known risk factor, you can take the tincture of Teasel to prevent infection, but it can also be used if one has the infection to rid themselves of the spirochete. So here's the classic bullseye rash associated with the tick bite that has a Lyme infection to it. Here's a picture of the tick on the left and the spirochete. So it's called a spirochete because it's a spiral-shaped bacterium that is the causal agent of Lyme disease. And essentially what happens is the spirochete burrows in along with the tick, aiding that process into the tissues, And then if you know it right away, then there is some effective antibiotic treatment. But very quickly, it begins to create a biofilm, which essentially is it's a self-secreted film that the bacteria makes, that the bacteria, as it replicates, it then shields itself, and it makes it very difficult for antibiotics to access it. So it's a protective packaging that this bacteria does. That's why it's so pernicious and protracted in its symptoms, because it hangs on so long, very difficult to treat. The green blocks on this map are the areas where Lyme disease has been detected. It looks like it's been detected in the Northeast. That's where I'm familiar with it having been, but its range has increased significantly over time. It's even here in Washington State and down through California. And I don't know what the incidences are, but there have been incidences detected. I've always, looked for this type of a rash. Commonly don't see ticks around, but they are seasonally dominant, and then they'll tend to go away. So the Teasel itself is not an antibiotic, but it functions and aids the effectiveness of the antibiotics one might be taking for the Lyme disease. Basically, it aids the release of the spirochete into the bloodstream. It breaks down the biofilm and essentially takes away the shelter for that bacteria, the spirochete, Borrelia burgdorferi. I think I've missed a G in there, but it allows it to be accessed by the antibiotics and allows the body then to clear the infection. So the dying bacteria and the toxins that it produces as it eliminates its byproducts are what are causing the horrible feeling that you're having, the cold, flu-like symptoms exactly. So the Teasel tincture can aid and allow the antibiotic treatments to be effective. Otherwise, they're just kind of bouncing through the body and not actually getting to their target organism. So that's the Teasel tincture. So the Lyme prevention, you can use the Teasel tincture for Lyme prevention. So if you don't have Lyme disease and you happen to be in an area of infestation, take a dropper full 2 times a day of the tincture. So this is quite a contrast from if you happen to have Lyme disease, 1 drop at a time. So there's a very distinct difference. If you don't have it, then you can prevent it by using a dropper full 2 times a day. So if you're bitten by a tick, save the tick for testing to make sure that you're free of the Lyme disease. This has been indicated that people who work in the woods oftentimes may be subject to tick exposure and Lyme exposure, will often use Teasel as a preventative to prevent themselves from getting Lyme disease. And if they end up with a tick that has it, early antibiotic treatment can help that being accessed much more quickly before a biofilm is set up. And even so, the Teasel helps to break down and dissolve that biofilm. So on the left is an electron micrograph of a Borrelia burgdorferi, and look at its subspecies name, persisters. So it persists because it has the ability to evade the antibiotics. So essentially that biofilm, we have a macrophage coming in or some other kind of white blood cell coming down, the big gray cell with the gray nucleus coming and trying to attack. They know there's something going on, but they just can't do anything about it. And the antibiotics can't access it because the biofilm is preventing those antibiotics from breaking them down. But it continues to replicate and the biofilm becomes larger and it can become quite detrimental over time. Joint pain, a lot of different other symptoms can be manifest associated with Lyme disease. So the prevention and the cure aid are present here for humans in the Teasel plant, the lowly Teasel. So it's also helpful in bone health, so osteoporosis, osteopenia, and fractures. So the Teasel root, it increases blood circulation and aids the rebuilding and regeneration of bone and tendon tissue and activates bone growth and density increases. So if someone suffering from osteoporosis, osteopenia, it's not so much because it has calcium in it, but it's in the bone growth activity and stimulation that is the benefiting aspect of the Teasel tincture, and from the root. It also has diuretic activity, basically aids the release of water, so it's helpful for edema, removing excess water, water weight, toxins, and various salts. It's also effective in the department of yeast. So that's candida and other types of yeast that people can have overgrowths of infections. And it can be very, very debilitating if they become excessive. And essentially, candida also is a biofilm producer, which is one reason why it's so difficult to eradicate candida. I did not know that until doing this study here. The yeast enters the bloodstream. Once it has been shucked from its biofilm, or the biofilm broken down, then when it's in the bloodstream, then it dies and is expelled. So there's probably going to be a cleansing response associated with that too, because it has its own toxins associated with it, and it helps to keep those yeast infections in check. So we probably all have various types of yeast that are present around us, but our body naturally keeps it in check unless there's some kind of a breakdown in our ability to do so, stress or whatnot, and then people can have a breakout in it, and it can protect itself with these biofilms. So that's a very important attribute of Teasel, is the breaking down the biofilm that shields these types of yeasts and bacteria like the spirochete from Lyme disease. Arthritis. So the Teasel root is an anti-inflammatory action, helps to increase blood circulation, basically helps the joints heal by having that increased circulation. Also provides some short-term pain relief, and you can also use it long-term with arthritis pain. So it also helps not only with the pain, but also with the cause of the pain, which are the underlying issues of circulation and joint repair. The liver. So there are various problems that can be, one can have the major filtration, not filtration, but detoxification organ of the body, the liver, including jaundice. So it's a good liver tonic. So a tonic is something that tends towards a strengthening of an organ system. And it has diuretic properties that help the liver to clear out toxins that may lodge in it, helps to reduce inflammation and infection. And it doesn't actually eliminate the causal agents or the sources of the infection, but it can help in the elimination of the infections. So using Teasel externally, so that would be a wash or a rinse. For skin wounds, actually a Teasel root powder as well. So the Teasel root powder, take the dried root, powder them. You can sprinkle them directly upon the area that is wounded, and it helps to dry up the skin wounds. Rashes, you could also use a Teasel root on that. So you'd use a flour-like paste of the Teasel root, and you just add some water to it to make it a paste and use it like a poultice. Put it on like a rash. So we're using the Teasel root tincture. This tincture is what is used for the Lyme prevention and eradication, as well as the other uses other than the root powder. So first of all, you need to have fresh, sliced, and chopped Teasel root, vegetable glycerin, unless you're using vodka, which is 100 proof. The vegetable glycerin is going to be able to extract the components, maybe to a lesser strength, and maybe it tends to have a lesser shelf life, but it's non-alcoholic, and that's a bonus. So use 2 clean jars with tight lids and a strainer. So those are going to be your supplies. You want to use the center of the root for this tincture. So the root, you can see the fork down the bottom, will have a fairly significant tap root associated to it, and you want to go for the center of the root. So place the chopped root center into the jar, leaving an inch at the top. So depending on the size of your jar is going to depend on the quantity of root that's going to be required. So big jar, lots of root; small jar, not so much. So cover it with the glycerin, fill it to the brim, and then cap it tightly, label and date it. So you want to make sure you know how long you've had it and what it is. Shake the jar weekly. You're going to be doing this over a period of 6 to 8 weeks, shaking every day. Usually set it on a covered shelf, so it's kind of out of direct sunlight. Sometimes you'll do an extraction or a tincture in sunlight, but most of the time it's in a dark area. If it's an alcohol base, you may need to add some alcohol later on, as some may evaporate and sneak out through even the tightly sealed jar. Once you've done that daily extraction of the medicinal qualities from the Teasel root over 6 to 8 weeks, strain it and add it to a clean jar. So that's your second jar, and then tighten that lid up. You can store it up to 5 years. So when you start to take that tincture again, barring the fact that you don't know whether you have Lyme disease or not. Typically, if you're not suffering symptoms, you should, first time using Teasel, probably be a good idea just to start with the 1 drop. And then after 3 days, add a drop, and then continue to add 1 drop at a time over a period of days spacing until a max of 9 if you have Lyme disease, and watch for that Herx reaction. So that's for the Lyme disease interaction with the Herx reaction. If it's preventative, once you know you're clear of Lyme, then it's the 2 droppers twice a day, or the dropper full twice a day. And that's how you make the Teasel root tincture.